Well, fears over the so-called tripledemic appear to be fading here in the U.S. Health experts had warned of a rough winter with a surge of cases of the flu, COVID-19, and RSV. And while hospitals did see an uptick in patients coming in this fall, cases of all three illnesses are now on the decline. So Dr. Céline Gounder is here with me in Studio 57 to talk a little bit more about this. She is the editor-at-large for public health at Kaiser Health News. She's also an infectious disease specialist and an epidemiologist. And of course, Dr. Gounder is a CBS News medical contributor. So thanks for joining us. So leading into this winter season, which we're still in the middle of, there was a lot of concern about this tripledemic, especially as people start to gather for the holiday season. What did we end up seeing with this tripledemic? And was it a tripledemic for everyone?
We really saw staggered waves of disease. So you saw RSV hitting the very youngest, flu and RSV as the kids get older, flu, and then eventually COVID in the oldest of the population. So over 65, COVID was really the biggest one. So some of that was staggered by age group. Some of this was staggered by time. And what we did see, though, is that population immunity against COVID in particular is much higher now in this year of the pandemic, the third year of the pandemic. We're not seeing the hospitals overrun with patients the way we did earlier on. And, we're just in a much better place to cope with this now.
Are we out of the woods in terms of a tripledemic? Because we still got February to go through.
That is right. So we could still see a resurgence of flu. Sometimes you have two peaks in flu. There is some unpredictability with RSV as well. Sometimes you have a spring surge. So we're not out of the woods yet and should still remain alert to these things.
Okay. So now let's talk about this idea of the possibility of a single COVID shot for the year, kind of like the flu shot. The FDA is going to be meeting on Thursday. They're going to discuss the country's vaccine strategy. What can we expect that meeting will be like?
So I do think you're going to see some scientific debate, and not everybody is on the same page about some of the details.
Right.
I think what you're likely to see emerge is an annual shot for most people, and 2 shots actually recommended per year for certain high-risk groups. That would include the elderly, people who are immunocompromised, very young children, pregnant women. But for most people, you're probably looking at 1 shot per year, not having to worry about how many shots did you get before, what infections might you have had before, just lining up for that shot, doesn't matter the brand anymore. Big picture though, when you have half the population in the US that for political reasons is not interested in vaccines and masks, there is some question as to whether we're really going to get the bang for our buck with vaccines. Is this truly the best way to control COVID at this stage if people aren't willing to line up for those shots?
Yes, I wanted to ask you about whether a strategy like that is more about just the overall health or infection rates in the country or about keeping individuals protected. Because I thought, if it's like the flu shot, how frequently do people get the flu shot? I don't imagine that it's a very high percentage of the population that gets a flu shot on a regular basis.
Yeah, it's at best 50% of the population that gets a flu shot. And that's with a lot of outreach and effort, and in particularly bad flu years where it's all over the news and people are more aware.
So a single COVID shot, it could be even lower percentage.
Could be even lower percentage. And I would not be surprised, given what we've seen with the booster uptake so far. It's been quite low, actually, with the latest round of boosters. And so there is some debate, is this the best use of our limited resources? Congress is not giving any more money right now for COVID. So with what little money we have left, could there be other things that we could do that might actually control transmission at a population level better than just vaccines?
Well, it should be an interesting meeting. Hopefully there is a lot of back and forth and robust debate. That's what we need. Dr. Céline Gounder, thank you very much.